It's wonderful to see everyone here in Assembly Hall at Stanford Healthcare, and also those of you who are joining us online. Welcome. Welcome to the second annual RAISE Health Conference and to AI Week at Stanford. That is Health and AI Week at Stanford. Every week is AI Week at Stanford, as it should be. So much has happened in the past year. And you'll hear about some of those developments and advances during the course of today. And for those of you who are participating in activities later on in the week as we continue to describe advances in activities in AI related to biomedicine, healthcare delivery, discovery, translation, and all other aspects of life sciences and healthcare that are being impacted by AI. So much has happened, and yet so much more remains to be done. And the focus of today's conference and of this week is on taking an assessment of where we've come, which is a far way from where we were just a year ago, and also what the opportunities are moving forward. Now, the transformation in biomedical discovery, translation of discoveries to new therapeutics and preventions, and the delivery of healthcare, that transformation is being accelerated and indeed transformed because of AI. But AI alone won't make the transformation that we want to see. We also have to look at the impediments to making sure that AI has the maximum impact possible. And those impediments include misaligned incentives in the way we deliver healthcare. They also include governance models. They include the fragmentation and siloing of data. And what we also hope to focus on during this conference and in the days that follow this week is how not only do we advance AI in its impact on healthcare delivery and discovery, but also how we address, confront, and change those impediments that already are impacting the ability of AI to help us do what we all want to do, which is to accelerate biomedical discovery, accelerate the translation of those discoveries into better treatments, and very importantly, into better predictions and preventions of disease altogether, and to transform the healthcare delivery system in our country and offer opportunities for improvements in healthcare delivery around the world. It's a bold vision, but it's a vision that I think we at Stanford are uniquely capable of carrying out because of the people we have here, because of the expertise we have historically and today in AI, in the development of the fundamental technology of AI, and also in the deployment of that technology in so many different ways. That, coupled with the fact that we have a robust ecosystem of biomedical discovery and healthcare delivery here at Stanford, and we're all on one campus, and we can bring together the people, the ideas, and the resources needed to develop AI and then to apply it to our healthcare delivery system and to our discovery-based biomedical enterprise. There's a lot to be done, but there's so much excitement here about getting it done. It's been incredible for me to get to know the people involved in this work, to support that work. You're going to hear today from the recipients of our seed grants in our RAISE Health initiative to learn about the work that philanthropy has enabled them to advance. And I know that moving forward, this work is going to have transformational impact and that we'll be able to accomplish what we want to accomplish because of all of you here in the room today, those of you who are joining online, and because of the spirit of innovation that is so well captured by what we're doing here at Stanford and increasingly in the world around us. So thank you very much for participating today. We hope that you have an enjoyable time, a productive time, an energizing time, both through this conference and moving forward. And now it's my pleasure to introduce my partner in the RAISE Health Initiative, Professor of Computer Science, Dr. James Landay. James?
Thank you, Lloyd, and thank you everybody for being here. And those of you who are out on the live stream, I noticed people as I was checking in with luggage, so thanks for folks who've traveled for this. As Lloyd said, I'm a computer science professor, but I'm also the co-founder and currently the Denning co-director of the Stanford Institute for Human-Centered AI. And when we founded the Institute almost 7 years ago, health and medicine, it was one of the key application areas that we were focused on, and Lloyd really was a supporter of the Institute from its inception and has been a strong supporter since, as well as the participation of several of the School of Medicine faculty. So as we gather to explore this intersection of AI and healthcare, I'm really reminded of the vision when we created that institute 7 years ago. When it was just an idea, we envisioned that the Institute would bridge disciplines and bring together minds across all 7 schools here at Stanford, including School of Medicine. And our goal was and remains today to advance AI research, education, policy, and practice to improve the human condition. And you'll see different aspects of that in this biomedicine and healthcare domain today. That ethos was also foundational to RAISE Health when we started that. We recognize that the development and deployment of safe, equitable, and responsible AI in healthcare requires more than just technical prowess. It demands a multi-stakeholder, interdisciplinary approach that considers ethical and social and medical implications of these powerful tools. And again, I think you'll see that reflected in today's program, as well as lots of the other research grants and programming that RAISE Health and HAI have been involved with. So as leaders in both medicine and AI, the folks in this room have a responsibility. We need to not only push the boundaries of what's technologically possible, but also ensure that these advancements serve humanity in the most beneficial and equitable ways possible. And so that means bringing together diverse perspectives from clinicians and computer scientists to ethicists and policymakers to shape the future of AI in healthcare. And so today's symposium is a testament to this commitment, and I really want to thank the staff who've done all the hard work of putting the symposium together. And so over the next few hours, you're going to hear from a range of experts who are going to share their insights on topics such as AI's role in biomedical discovery and new research projects centered on building the trustworthiness of AI models, advancing evaluation methods for fair algorithms in healthcare, and developing programs that help patients, care providers, and researchers navigate the rapid AI advances. And these discussions are crucial as we work to harness the power of AI to improve patient outcomes, reduce healthcare disparities, and enhance the overall quality of care. But besides the presentations and panels, I encourage all of you to actively engage in the conversations that will unfold. Your own diverse experiences and perspectives are invaluable in helping us navigate the complex landscape of AI in healthcare. And I know for many of the faculty, working with folks who are on the front lines of some of these problems really helps drive where our research goes in the future. So it's through this collaborative spirit that we can truly realize the potential of AI to transform healthcare for the better. So, thanks for being part of this important endeavor. I look forward to insightful discussions and collaborations that emerge from today.